Dental bridges are the most commonly used method of filling in missing teeth. They usually consist by 2 or 3 crowns, which are placed on the opposite end of the gap left by the missing tooth using a false tooth between them to fill in the gap. Dental bridges can be a long-lasting choice for replacing your smile. However, how long do you think their lifespan? The longevity of a bridge is contingent on a number of variables, including the type of bridge used, the type of material, practices for maintaining your oral hygiene, as well as how much you care of your dental health. The majority of dental bridges are able to last for 5 to 15 years or longer with the right maintenance. The traditional dental bridges that are held by crowns attached to the teeth adjacent to them, they are the most commonly used type of bridge. They are able to last for up to approximately 5 to 7 years. The bridges comprise substances like porcelain fused with ceramic or metal. These materials last for a long time and are sturdy. Over time, the bridge could be worn out, lose its strength, or show signs of decay along the edges. This can result in failure and the need to replace it. Another kind of dental bridge is a cantilever and is only supported on one end through a tooth-shaped crown. They are not frequently used since they place more pressure on the tooth supporting them and might not be as sturdy as conventional bridges. This means that they might have a less long time to life of 5 to 10 years. Maryland bridges are also referred to as resin-bonded bridges, offer the most conservative choice that is based on bonding a steel or porcelain frame on the back of adjacent teeth. This eliminates the requirement for crowns. Bridges that are resin-bonded can last 10 years or longer provided they are properly taken care of. However, they won't have the same strength or durability than the traditional bridges. Implant-supported bridges are a different option for repairing missing teeth. They are considered to be the strongest and long-lasting option. They are supported by dental implants. They are surgically placed into the jawbone in order to create an extremely solid base that will support the bridge. Implant-supported bridges last 10 years or more if they are properly upkeep and treatment, making the bridges an extremely popular option among patients. To prolong the life of your bridge, it's essential to practice healthy oral hygiene like regular flossing and brushing, in addition to making regular visits to the dentist for examinations and cleanings. Refraining from eating hard and sticky foods which could put pressure on your bridge and result in harm is crucial in extending the lifespan of your bridge. Sometimes the dental bridge could have to be replaced earlier than you anticipated because of the wear and tear of time, tooth decay, or other problems. If you feel any pain or discomfort on your bridge, it's essential to consult your dentist as fast as possible in order to fix any issues and stop the damage from getting worse. The life expectancy of a dental bridge could be different based on the style of bridge you choose, the material used, and the way you care for your dental health. When properly maintained and cared for, the bridge could last from 5 to 15 years or longer. Following the recommendations of your dentist as well as practicing proper practices for oral hygiene to keep your bridge and ensure an attractive, healthy dental bridge for many years to come.